I'm Dr. Tabatha, the Gutsy Gynecologist. I'm a triple board certified OBGYN and functional medicine physician. I've embraced the world of functional medicine and wellness through my own personal health journey, and I'm super excited to share my wisdom and unique perspective as it pertains to women's health. After caring for thousands of women, I've come to realize that your gut health determines your gyne health and your overall health. And it's a super gutsy thing for me to go against conventional gynecology practice to bring you the truth. No more Band-Aid medicine, ladies. We're talking root cause resolution on this show. So if you're struggling with hormone imbalance, weight gain, period issues, anxiety, insomnia, you name it, then you've come to the right place. And I want to be your gutsy gynecologist. So welcome. I asked my doctor about getting progesterone, and she said, no, I don't need it because I've had a hysterectomy, but I still have anxiety and feel terrible. What should I do? Okay, this is a question from Rachel in Arizona. Oh my goodness, Rachel. I think you need to find a new doctor, honestly. Here's the deal, you guys. Progesterone protects more than your uterus. Okay. As a conventional doctor, I was trained that progesterone is only needed to protect your uterus from unopposed estrogen. That is what we came to understand from studies that were done way back in the 50s, 60s, and 70s. So here's the problem. Since then, we have learned that there are not only progesterone receptors in the uterus, but all throughout our body. There are progesterone receptors in our breasts, in our cardiovascular system, in our brain, in our bones, in our skin, like everywhere. So if you have unopposed estrogen in other parts of your body, like your brain, it doesn't feel so hot. And you'll notice because you probably have more anxiety. You're probably not sleeping as well. Your weight may fluctuate and you're puffy or bloated and swollen. You probably should be on progesterone if you are an estrogen replacement. I have only had a few patients that are on estrogen alone tell me they feel good. And those are usually much older women, meaning they've been in menopause for quite a while. They've gone without the progesterone for many years and their body has adapted. But for the majority of women, they don't feel good on just estrogen replacement alone. So, unfortunately, it sounds like your doctor is practicing some antiquated medicine. That is very common. That is still standard of care in this country, unfortunately. That is still what is being taught through American College of OBGYNs and the North American Menopause Society. I know this because I am certified through them. So I know what everyone recommends, but that doesn't mean it's right. Just because something is popular or common or is a standard doesn't mean it's best practice. It doesn't mean it's up to date on the latest research. So it turns out we have estrogen receptors in our whole body, and we feel better when estrogen and progesterone are balanced together, and testosterone as well. So I would encourage you to consider getting a second opinion or getting some resources, giving it to her or him, and having a further discussion. Hey, do you mind if maybe I try some micronized progesterone capsules at bedtime and see if I just feel a little bit better? And maybe they'll be on board with that and maybe not. So I hope that answers your question. All right. Bye, guys.